Chapter 12. Dr. Pole. Dr. Lars Pole's hand was firm when it shook mine, and his voice was deep and strong, even gruff. His shaving lotion smelled crisp. He soon asked the same questions that Dr. Boomstrad had asked, taking notes, I think, but he wasn't as much interested in what happened on the island. He was more concerned about the headaches I'd had. Later, my parents described him as square-faced and gray-haired, a large man with bushy eyebrows and a big nose. His cheeks were red. He was Danish. They said he had powerful hands with long fingers. Along with his diplomas, my father said, there were autograph pictures on his office walls. Babe Ruth and Lou Gehrig, baseball stars of that time among them. He shone a light into my eyes, asking what I could see. Nothing. He felt the back of my head. Will I always be blind? Instantly, I didn't want him to answer that question. He paused, likely studying my face, then said, To tell you the truth, Philip, I can't say. There's a possibility that what has happened can't be reversed. In fact, there are a variety of possibilities here. He paused again. A variety of possibilities? Doctor talk, I said. But let me finish. I've studied your x-rays, but cannot judge from them just how much damage has been done. My father had arrived in the morning, and now I felt his hand on my shoulder. He squeezed it to remind me that he was there. How can you tell? I asked. Another procedure, and I'll get to that. But first, let me try to explain, as simply as possible, what I think, just think, happened to you, Philip. I believe whatever struck you in the back of the head caused internal bleeding in an area of the optical lobes. I frowned. What were those? The function of the optical lobes is to receive sensory information from the optic nerves, the eye nerves, and process it. They are the center of the brain for vision. Your eyes are only cameras. I think you have an AV malfunction, an artery vein malfunction. My frown must have deepened. I'm showing pictures in a medical book to your parents and will also explain them to you. Here are the normal blood vessels in plate 84, like little bending hoses. Now we see them damaged in plate 85. They look like clusters of grapes with stalks. A vessel bleeds and stops and clots. Pressure builds up, and another starts to bleed, and it clots. Another does the same thing, seeps and clots. I think these clots, these grape clusters, are causing your problem. He paused to let it all sink in. What can we do to fix them? I asked. Every one of the damaged multiple little vessels would have to be cauterized and then repaired with a metal clip or stitch to stop the bleeding. Each one would have to be identified, a very delicate operation, working up against the brain. And that would fix it? I asked. Perhaps, but it's a very long, risky operation, requiring a team of surgeons. I liked the way he was talking directly to me. I've done 9 so far, all on adults, all within days or weeks of the injury. You've had yours for going on 6 months. My father asked, What kind of success have you had? Dr. Pole did not hesitate. 3 out of 9 regained partial vision. 1 died on the operating table. 1 is brain damaged. So 5 are still as blind as the day I performed surgery on them. 3 out of 9? My mother said, a quiver in her voice. Dr. Pole replied, Philip's age may possibly be to his advantage. Then he said to me, But I doubt if you'll ever have a complete return of vision. The 3 that were successful, how much vision did they have? I asked. 2 had 80%, 1 90% with glasses. Not that much at night. 90% with glasses. I'd be able to see most things, read, move around without a cane. I guess he was studying my face when he said, Very clearly, I repeat that there is a risk, Philip. I have to be honest with you and your parents. Major risk. This will be inside your skull, against the brain. Inside my skull? Against my brain? The biggest concern is with the lining of the brain. I'll be a fraction of an inch away from three very important vascular structures, blood channels. I'll skip the scientific names for them, but they carry much of the blood away from the brain and return it to the heart. Any of the three could have been injured at the time of the accident or could be injured during surgery. Your life could be lost. You could be paralyzed. My mother said, I don't think we need to hear any more, Dr. Pohl. It was my vision he was talking about, not hers. I asked, what happened with the one person who died? Hemorrhage that we couldn't stop. A ruptured blood vessel. What you have here, Philip, and Mr. and Mrs. Enright, is a choice between remaining blind as a relatively functional person for an undetermined period versus the possibility of an acute problem during immediate surgery that may leave you, and I repeat, paralyzed, vegetation, or dead. My mother said firmly, with those options, Philip will have to remain blind. My father said, not so quick, Grace. He has to have a voice in the decision. What do you mean by undetermined period, Doctor? That sounds scary. Well, until we can take a look at the problem, beyond x-rays, there's no way of knowing exactly how severe it is. It just takes a small amount of blood to disturb the function of the brain. There can be lasting side effects. Silence from all three of us. We knew he meant that I might die anyway from malfunction. He said, you don't need to decide today, but each day that goes by lessens the chance for any success. 8 didn't die, I said, but 5 can't see, my mother said. There was another long pause. Then my father said, Doctor, Philip faced life and death decisions on that island. He survived. I knew he was talking to my mother as well, saying to her, stop thinking of him as a child. So he has the right to make a decision. It's his sight, his life. I sat there knowing they were looking at me, waiting for me to say something. I thought a lot about this moment since the session in Dr. Boomster's office. Thought about it on the plane to New York. Thought about it almost all the time. I was awake since arriving. I wanted to know exactly what was going to happen, and said so. The doctor hesitated. Later he told me he hesitated because he was afraid I'd become frightened. How much do you want to know? I said, I would like to know how you get there. Dr. Pohl hesitated again. Then I heard a deep sigh. All right. Simply because you did survive alone on that island, and that means to me you're mentally strong. I'll tell you. I'll also tell you, Philip, that most adults wouldn't want to hear about the exact procedures. I was physically strong, but didn't know about the mental part. Stop me whenever you wish, he said. I nodded. You'll be put to sleep, and your respiration and blood pressure will be carefully watched. You'll be placed on your belly because we have to have complete access to the back of your head. As if he'd written it down word for word, I remember what he told me. The first step was to make an incision on the back of my skull, a straight incision. Then instruments would pull the skin of my scalp to the side to expose the skull bone. After that, he'd make 4 or more holes in my skull. How do you make them? I asked. With a hand drill. I heard my mother moan. Like woodworkers use? Exactly. He then used a lot of scientific words like transverse, venous sinus, and superior sagittal sinus, without even thinking we didn't know them. Then brought himself up short, apologizing. What we'll do, Philip, if you make the decision to go ahead, is to place a guide between the 4 bored holes and then use a giggly saw, a wire saw, back and forth until the necessary bone cuts are made to provide an oblong window for surgery. A window in my skull. The second procedure will be to go through that window and try to repair the blood vessels. Will you put that window part back? He laughed a little softly. Yes, we certainly will. When we replace it, we'll make up a paste out of shavings from the bone to hold the piece in place. Then your own cells will grow together, though you'll always feel a little depression back there. How long will I be in the hospital? You should be on your feet in 2 days, but we'll keep you for about a month for observation. If everything goes well, your vision will return in about 2 weeks. What about after effects? My father asked. Probably some residual headaches, but they should go away after a while. A possibility for some seizures, but they can be controlled with drugs if they occur. Seizures? My father said. Similar to epilepsy? Exactly. As you likely know, there are 2 types, petit mal and grand mal. The petits are more of a nuisance than anything else. You might be drinking soup, and for a split second will stop the spoon in midair. The grand mals are a lot more serious. The patient loses consciousness. We had a boy at school with epilepsy. Without warning, he'd pass out, fall down, then his muscles would jerk. He might froth at the mouth. Drugs can control them, and eventually they'll go away. But you have to take the drugs regularly, Dr. Pohl said. What causes them? I asked. Disturbances of the brain's electrical activity. In your case, there will have been quite a shock to your circuits. I'd heard enough. It's a very serious, risky operation, 8 to 12 hours long, and you may lose your life, Philip, or, as I said before, become almost totally incapacitated. Or I may see again, I said. Yes, he agreed. You said 90% of one of the adults. No guarantee of that percentage, he said bluntly. Another thing, there could be problems even if the operation is successful. Infections of the wound, a blood clot forming on the surface or inside of the brain. You don't sound too optimistic, my father said. I'll be honest with all of you, the doctor said. Finally, after a few minutes, I said, Can I think about it? Never had I been so scared, not on the raft or on the K. Of course, but the sooner you make the decision, the better. If you decide to go ahead, we'll need to do a pneumoencephalogram. That's the procedure I mentioned before. Again, I was lost in the medical terms. What's that? More x-rays. We'll put you in a chair and inject air into your spine, then rotate the chair in different directions. By putting air in, we can see more of what the problem is, then go in and operate.